$77 billion just in 2015 alone. The total cost for exchange and Medicaid-related spending next year, due to the law, jumps to $116 billion. Today's hearing comes at a critical time. Today, we are just over a week away from the start of open enrollment for federally subsidized exchange coverage under the Affordable Care Act. So, it is important that we examine the administration's actions taken or not taken to impact the accuracy of Medicaid and exchange coverage eligibility determinations and the federal matching rate for state Medicaid expenditures. Previous reports in 2014 and earlier this year from the nonpartisan Department of Health and Human Services Office of Inspector General, the OIG, and the Government Accountability Office, the GAO, have raised very serious concerns about the systematic and ongoing vulnerabilities of eligibility verification systems in place governing the healthcare.gov and state-operated health exchanges. It is important that today we not only get an update on the exchange systems, but also examine federal efforts undertaken to ensure the accuracy of. We will also look at the federal and state procedures to minimize duplicative coverage for Medicaid and exchange premium subsidies. Regardless of member differences over the ACA, I hope we can all agree that good government need not be a partisan issue and that protecting taxpayer dollars is a constitutional responsibility we all share. Federal officials have a legal and ethical duty to be good stewards of federal dollars and ensure programs operate within statutory requirements. If an individual is not eligible for a program, taxpayers should not be forced to subsidize that individual just because federal controls are lax. Our two witnesses today are from the GAO, and we appreciate their presence with us. They will share with us the data-driven assessment from the nonpartisan GAO regarding a range of challenges related to exchange eligibility controls and the Medicaid expansion. I now recognize the ranking member of the subcommittee, Mr. Green, 5 minutes for his opening statement.
Thank you, Mr. Chairman. Gosh, our mics are louder this time.
Yeah, there's a ring.
Even on the first floor, they were loud the other day.
A little bit loud. The mic is a little bit too loud. Yeah.
Well, thank you, Mr. Chairman. And I can't agree any more than what you said about good government's not a partisan issue. But I have to admit the hearing this morning is, I'm disappointed because, for one thing, our office didn't get the GAO report within the 48 hours we should have had to be able to properly prepare. And this is a hearing by ambush. It's just not the way this subcommittee ought to work. And I have a briefing, or I have a list of things that the GAO in their report, but again, I don't know if that's a game that was being played the way this Congress ought to legislate, particularly in the Energy and Commerce Committee. I've been on the committee since 1997, and I hope this is not the standard we're going to be using. And I'd like the unanimous consent to place my statement in the record. But again, I don't think any of our members have had the opportunity to look at the GAO. They couldn't release it to us because of the request from y'all and from the Republican majority. And we would expect the courtesy of being able to get a report so we can actually prepare questions and a statement in response. But I will start with saying—
Would the gentleman yield just a moment? The staff informs me that you received the embargoed reports on Monday, the same time we did, and testimony on Wednesday. We got it at the same time.
When did they give us the report on GAO?
On Monday.
Well, from what I heard last night when we were briefed is that we got a copy of it, but then it was requested not to make copies of it and not to give back. And again, I hope our staff doesn't play games like that.
They were
what we need to do.
Is my understanding.
Well,
Anyway, we'll try to make sure you get them in plenty of time in the future.
let me talk about some of the concerns I have about the findings presented in the hearing of the GAO undercover testing as preliminary. They were put in testimony form and given the minority less than 2 days prior to the hearing. These findings are not generalized by GAO's own admission. The investigation was based on a small, statistically insignificant number of GAO-created fictitious secret shoppers. These secret shoppers are not representative of the average consumer. GAO used the federal government's resource and knowledge when forging documents. GAO knew all the fraud prevention safeguards that were in place in advance and had experience getting around these controls. Mr. Chairman, I know of no Republican supports the Affordable Care Act. Frankly, you couldn't survive a primary if you did. But again, we're legislators, and we shouldn't have a hearing where if you want to go after the ACA, we'll be glad to battle with you, because I can talk about the success it is. 17.6 million uninsured have attained coverage. I was hoping we would get past this and we would actually be legislating. If there's problems with the Affordable Care Act, then let's fix them. Some of the things that were in the bill or in the law now were what the Senate put in, and believe me, I'd like to change some of those. But again, to have a hearing in our health subcommittee without having adequate notice, because we could even prepare for the GAO report. And again, I'll yield back my time, but ask unanimous consent to be able to place a statement into the record later.
Chair recognizes Vice Chair of the full committee, Ms. Blackburn, 5 minutes for opening statement.
Thank you, Mr. Chairman, and I want to welcome our witnesses. I am so pleased that you are here and that we've got a chance to talk about eligibility standards and the eligibility systems for Medicaid. And Obamacare has changed a lot of this, and we know that that focus at Obamacare has been on bolstering enrollment numbers. And it didn't matter what the cost was, it was get the numbers up. So they've really thrown the door open for fraud. Now, I come from a state that has a track record of working through expansions and enrollment. I come from Tennessee, and we were the test case with TennCare. We were the test case for Hillary Care. You all are familiar with that story, and you know what happened in our state. It was rampant with abuse. We didn't need secret shoppers. We had people that were coming from Kentucky and Alabama and Georgia and North Carolina and Arkansas and Mississippi and jumping into the TennCare program. And we had a fraud unit. We had to go in. I was a state senator, set up a fraud unit because the fraud was so rampant. The reason, it turned out, was there was no verification or re-verification of the eligibility standards. So people said, hey, this is great. It is a come on in. Get what you want. And some of the cases that are there of the fraud that was rooted out and found are astounding. People that would enroll a spouse with dementia in the program, and then they would be driven by ambulance from another state to Tennessee for their doctor's appointments, return home, then put in long-term care facilities, nursing facilities. And how did they get by with it? Because there was no re-verification and no checking on these eligibility standards. We know that fraud is a problem. I find it amazing that HHS responded to the GAO findings. And Mr. Chairman, I just want to read this quote. It's important to consider whether it's likely that uninsured Americans would replicate the next actions the GAO took, namely knowingly and willingly providing false information in violation of federal law, which could subject the individual to up to a $250,000 fine. Does anyone realize how totally naive this statement from Megan Smith from HHS is? If you have someone who is terminally ill and you can skirt the eligibility because you know there is no re-verification, $250,000, you bet. They're gonna give it a shot and see if they don't get caught. And if they can get by because there is no verification. Mr. Chairman, I appreciate the attention to this issue. I appreciate that much of the escalation in the cost per enrollee rate comes down to fraud. I yield back.
Chair, thanks to gentlelady. Now I recognize the ranking member of the full committee, Mr. Pallone, 5 minutes for his opening statement.
Mr. Chairman, I think we would both agree that this committee has a long history of working respectfully together, even on the most difficult of topics, but unfortunately, that did not happen here today with this hearing. It seems to me that my colleagues want nothing more than a splashy top-line message to justify their obsession with undermining the Affordable Care Act, the result of which is an attempt to take away health care coverage from millions of Americans. I say this partly because I received only one paper copy of each of the GAO reports under discussion from the majority approximately 72 hours before this hearing, despite the fact that my staff had asked for these reports for at least a week prior, and my staff had to push multiple times for a time briefly from the GAO on this preliminary so-called fake shopper undercover work, also the topic of today's hearing. Meanwhile, the only documentation available regarding the fake shopper investigation was GAO's testimony, which was made available to our committee less than 48 hours ago, and this is not a positive reflection on this committee. Let me also point out that while today's hearing may purport to be an honest examination of GAO's work, I question GAO's motives and methods. GAO is supposedly a nonpartisan body. Its mission is supposedly to help government work more effectively and efficiently, but it's certainly basically trying to take coverage away from millions of fellow Americans. That's a pretty sad goal, and certainly not something that they should be proud of. The fact that GAO refuses to provide CMS with the information on the fake identities it created so that the agency can learn from the GAO's work and fix potential vulnerabilities in the system runs counter to their mission. That is why I sent a letter this morning to GAO Controller General Gene Dodaro outlining these and other growing concerns about GAO, and I hope he conducts an investigation of the policy of the GAO in this case. Mr. Chairman, I do not believe that today's hearing is about program integrity. It's just another example of Republicans' relentless and tone-deaf war on the Affordable Care Act. In addition to GAO's fake shopper investigation, we'll hear today about 2 additional reports. If it were not for Republicans' continual mission to undermine the ACA, these reports could have provided a good policy discussion. Both highlight important areas where the agency should continue to focus on the ACA's streamlined no wrong door policy. That policy rightly allows consumers to apply for coverage on either the marketplace or with their state Medicaid agency to ensure appropriate health care coverage. Importantly, the reports highlight the extensive amount of work the federal government and states have done to improve these processes. In fact, CMS is already implementing all of GAO's recommendations. But I cannot say the same for the preliminary fake shopper investigation. Realistic test of the accuracy and effectiveness of the eligibility and enrollment system in the new healthcare marketplace. In fact, no reality exists in which a person can financially gain from gaming this system. At best, someone would pay an insurance company a monthly premium, pay their deductible, all to get well from an illness or disease. And this is not some charlatan's trick. What is it that the GAO is trying to accomplish here? I'd like to know to what extent. My understanding, and I'm going to ask this in my question, is that you are federal employees. You get your health insurance through the federal employee program. But there are a lot of people that don't get health insurance that easily and have to go through this system with the exchange. And it's often difficult for them to do that. And I understand that it's difficult. And I understand that there are problems. But for you to spend your time and your effort, taxpayer money, in trying to make it more difficult or somehow highlight the difficulties, I just don't understand. It's inconceivable to me that some of the most vulnerable individuals in this country would have the desire, time, money, and expertise to try over and over again to fraudulently gain coverage. In fact, I worry that some of our country's neediest individuals end up foregoing coverage because the system is still confusing to them. And I want to commend HHS for criticizing the way GAO went about this, frankly. Mr. Chairman, all of GAO's fake shoppers that went through the healthcare website failed the identity check. They were all required under penalty of perjury to submit additional documents, at which point GAO provided counterfeit information, such as fictitious Social Security cards and immigration documents. Further, GAO stopped short of filing tax returns for the fake shoppers. That makes it clear to me that we have important controls in place. Republicans have said that Democrats care too much about ensuring people and access coverage, and that's an accusation that I'm proud to own. I do believe that priority should be first and foremost that people can access the coverage they need or are entitled to have, and I'm proud to have been a chief architect of the law that helped that happen. Thank you, Mr. Chairman.
Chair thanks the gentleman. Again, let me just briefly reiterate. The minority received the testimony on Wednesday when we received it. I am told the GAO briefed the minority last Friday, and we provided the full report on Monday to your office, Mr. Pallone, which I understand you distributed to the member offices. So we gave the minority more info and lead time than required under the rules. And this hearing is about accountability, which all of us want. So with that, sorry to have this start on a partisan note, but that concludes the members' opening statements. As usual, all members' written opening statements will be made a part of the record. And we will proceed to our panel. Our two witnesses today are from the GAO, and we appreciate their presence with us. They will share with us the data-driven assessment from the nonpartisan GAO regarding a range of challenges related to exchange eligibility controls and the Medicaid expansion. And on our panel, we have Ms. Carolyn Yoakum, Director, Healthcare of the Government Accountability Office, and Mr. Seto Bagdoyan, Director, Audit Services, Forensic and Investigative Services, General Accountability Office. Thank you for coming today. Your written testimony will be made a part of the record. You'll each be given 5 minutes to summarize your written testimony. And Ms. Yoakum, we'll start with you. You're recognized for 5 minutes for your summary.
Thank you. Chairman Pitts, Ranking Member Green, and members of the subcommittee. I'm pleased to be here today to discuss issues related to CMS oversight of Medicaid eligibility determinations and coordination between Medicaid and the health insurance exchanges, which are also referred to as marketplaces. The Patient Protection and Affordable Care Act has provided millions of Americans new options for obtaining health insurance by qualifying for Medicaid or purchasing private insurance through a state-based or federally facilitated exchange. Because income volatility occurs for many low-income individuals, they are likely to switch between Medicaid and subsidized exchange coverage. It's been estimated that 6.9 million during the year between Medicaid and the exchanges. However, the complexity of designing such coordinated processes can raise challenges, and careful CMS oversight is crucial to ensure that Medicaid eligibility determinations are appropriate and that the risk of coverage gaps and duplicate coverage is minimized. My statement draws from two reports and will focus on, first, CMS oversight of enrollment of beneficiaries and reporting of expenditures, and secondly, the extent to which CMS and states had policies and procedures in place to reduce the potential for coverage gaps and duplicate coverage when individuals transition between Medicaid and the exchange. Regarding Medicaid enrollment, CMS has taken some interim steps to review the accuracy of state eligibility determination and examine states' expenditures for different eligibility groups, but more efforts are required. In particular, CMS has excluded federal eligibility determinations from their review. This creates a gap in efforts to ensure that only eligible individuals are enrolled in Medicaid and that state expenditures are correctly matched by the federal government. CMS also does not use information from these eligibility reviews to better target its oversight of Medicaid expenditures for the different eligibility groups. Consequently, CMS cannot identify erroneous expenditures due to incorrect eligibility determinations. To improve its oversight, we recommended, and CMS generally agreed, that CMS should review federal determinations of Medicaid eligibility for accuracy and use the information obtained from state and federal eligibility reviews to inform its review of expenditures for different eligibility groups. With regard to coordination between Medicaid and the exchanges, CMS has implemented several policies and procedures and has additional controls planned to minimize the potential for coverage gaps and duplicate coverage. However, we found weaknesses in internal controls for these federal exchanges. For example, CMS's controls do not provide reasonable assurance that electronic records for individuals transitioning from Medicaid to exchange coverage are transferred by states in near real time, thus putting individuals at greater risk for experiencing gaps in coverage. We also found weaknesses in CMS's controls for preventing, detecting, and resolving duplicate coverage. To further minimize the risk of coverage gaps and duplicate coverage, we recommended, and CMS agreed, that CMS take 3 actions. First, to routinely monitor the timeliness of account transfers from states. Secondly, to establish a schedule for regular checks of duplicate coverage. And then thirdly, to develop a plan to monitor the effectiveness of these checks. CMS did report a number of planned steps to address the risks that we identified. Chairman Pitts, Ranking Member Green, and members of the subcommittee, this concludes my statement, and I'd be pleased to respond to any questions.
Chair thanks the gentlelady and now recognizes Mr. Bagdoyan, 5 minutes for his summary.
Thank you. Chairman Pitts, Ranking Member Green, and members of the subcommittee, I am pleased to be here today to discuss the preliminary results of GAO's undercover tests assessing the enrollment controls of the federal marketplace and selected state marketplaces under the ACA for coverage year 2015. We performed 18 undercover tests through phone or online applications. Our tests were designed specifically to identify indicators of potential control weaknesses and inform our separate forensic audits of these controls, which cover the entire universe of enrollees. I would note that our results, while illustrative, cannot be generalized, as pointed out earlier, to the entire applicant population. We did discuss details of our observations extensively, both with CMS and the selected states, to seek their responses to the issues we identified. CMS and state officials explained, for example, that in the applicable instances, the marketplaces and Medicaid agencies are only required to inspect application documentation for obvious alteration. If there are no signs of alteration, the documents won't be questioned for their authenticity. In terms of context, health coverage offered through the marketplaces is a significant expenditure for the federal government, as Chairman Pitts pointed out. Current levels of coverage involve several million enrollees, of whom about 85% are receiving subsidies. CBO pegs subsidy costs for fiscal year 2016 at about $60 billion and a total of $880 billion for fiscal years 2016 through 2025. I would note that while subsidies are paid to insurers and not directly to enrollees, they nevertheless represent a financial benefit to them. I would also note that a program of this scope and scale, millions of enrollees and hundreds of billions of dollars in expenditures, is inherently at risk for errors, including improper payments and fraudulent activity. Accordingly, it is essential that there are effective enrollment controls in place to help narrow the window of opportunity for such risk and safeguard the government's investment in the program. With this as backdrop, I'll now discuss our test's principal results. Overall, we first observed no year-on-year improvements in the federal marketplace's controls from our coverage year 2014 tests. Second, we found similar control vulnerabilities in the state marketplaces. And third, following these systems' own instructions, employed relatively simple workarounds, such as making phone calls and making self-attestations to circumvent the controls we did encounter to obtain coverage. More specifically, the federal and selected state marketplaces approved subsidized coverage, either private plans or Medicaid, for 17 of our 18 fictitious applicants. The subsidies totaled about $41,000 on an annualized basis. For 10 applicants, we tested application enrollment into subsidized qualified health plans, or QHPs. available through the federal marketplace to include the states of North Dakota and New Jersey, and state marketplaces in Kentucky and California. These applicants were directed to submit supporting documents such as proof of income or citizenship, and submitted fake documents in response. In each instance, the federal or state marketplaces approved coverage. This included 4 applications where we used Social Security numbers that could not have been issued by the Social Security Administration. For the remaining 8 applicants, we tested Medicaid enrollment through the federal marketplace as a portal for North Dakota and New Jersey, and state marketplaces in California and Kentucky. For 3 of 8 applications, we were approved for Medicaid. In each of these tests, we provided identity information that would not match SSA records. Each applicant was directed to submit supporting documents. Again, we submitted fake documents and the applications were approved. For 4 of 8 applications, we were unable to obtain Medicaid approval. However, as a result of this failure, we subsequently applied for and were approved for subsidized qualified health plans. For the remaining application, we were unable to apply for Medicaid coverage in California because the applicant declined to provide a Social Security number, citing privacy concerns. In closing, our results highlight the need for CMS and the states to make program integrity a priority and implement effective controls to help reduce the risks for potential improper payments and fraud. Otherwise, there is significant potential for such risks to be embedded early in a major new benefits program such as the ACA. We plan to include a number of recommendations to CMS regarding controls in a forthcoming report, and we have already discussed these recommendations in detail, including with Acting Administrator Slavitt. Mr. Chairman, this concludes my statement. I look forward to the subcommittee's questions.
Chair, thanks, gentlemen. Thanks both of you for your testimony, and we'll begin questioning. I'll recognize myself 5 minutes for that purpose. And this question is for both of you. Start with you, Ms. Yoakum. Today, we are just over a week away from the start of open enrollment for exchange coverage under the Affordable Care Act. Do you have any reason to believe that the vulnerabilities identified by GAO and reported in your testimony have been sufficiently addressed by CMS, or are these program gaps and vulnerabilities ongoing?
There certainly are remaining concerns about the need for better oversight of the eligibility determination process, and also checking for to ensure that the appropriate matching rate has been used. CMS has taken some actions over the course of the summer, but there's more to do.
Mr. Magdoyan?
Yes, thank you, Mr. Chairman. I would echo what Ms. Yoakum said in terms of questions and concerns that remain. As I mentioned in my opening statement, we have not detected any change in the CMS control environment, which is the broad set of controls from the front, the middle, and the end. In fact, for the end control, which is essentially the tax reconciliation process, there have been several reports from the Treasury Inspector General for Tax Administration, the HHS OIG, as well as GAO itself, questioning the capability of CMS and the IRS to effectively implement that control. So my answer would be the vulnerabilities remain based on the evidence that we have.
When did GAO first make CMS aware of the vulnerabilities identified? For example, in the Undercover work specifically, hasn't CMS known about these problems since at least last summer? Ms. Yoakum? Or Mr. Go ahead.
Yes, thank you. Yes, we had a hearing before House Ways and Means Committee in July of 2014, and we discussed our initial look at the time for coverage year 2014 with CMS in detail, so they were aware at least of the very specific issues that we raised in terms of control vulnerabilities.
Let's continue, Mr. Bogdoyan. During the first 2 years, GAO has successfully obtained federally funded or subsidized coverage for 28 of 30 of the fictitious applicants, each of which should have been denied coverage because they did not have or provide sufficient evidence of eligibility, according to your testimony. That's a 93% error rate. Does GAO find that acceptable? I mean, is there any other federal government program with even near as high an error rate?
Well, I would certainly caution the use of that 93%. Certainly, the sample we used was not generalizable. It was designed to raise concerns and flags about specific controls. As you know, the issue of improper payments was discussed by the Comptroller General recently. The trend is up after several years of some modest decline. So that's the environment we're looking at this issue overall. We're not trying to specifically target any one individual for their health coverage. As I mentioned in my opening statement, we have parallel forensic audit work ongoing right now, and that is looking at each and every enrollee in the system, and we would be subjecting those enrollee databases to various types of analyses.
Yeah. Now, support applications do not represent actual fraud, and question whether GAO has identified any real fraud. It is my understanding that GAO's undercover work was also supposed to be paired with a forensic audit of actual exchange enrollment data, but the CMS has stonewalled GAO in providing the data necessary to do that work. Can you please describe the delays GAO has experienced in obtaining the necessary data from CMS?
Sure. Yeah. First, to just restate the fact that the work we did undercover was not designed to detect fraud per se in the general population. Although when we did perform the work, we obviously engaged in fraudulent activity, which is consistent with our investigative authority for these purposes. And yes, we do have ongoing forensic audits for coverage year 2014. In discussions with staff, we are ready to request 2015 information for coverage year 2015, rather.
And could you just briefly...
Yes, I will mention that our initial contact with CMS to obtain the 2014 data began in April of last year, and it was not resolved until recently this year. So it took about a year of negotiation to obtain that data set.
Okay, my time has expired. The ranking member, Mr. Green, 5 minutes for questions.
Thank you, Mr. Chairman. Thank the witnesses for your testimony today. Mr. Bagdoyan, I want to ask some of the results of your preliminary results of your work on the eligibility and enrollment, and hopefully, because I have a lot of questions, we can get yes or no. First of all, how many fictitious identities did GAO create and attempted to get the coverage for Medicaid or subsidized marketplace coverage?
For coverage year 2015, which is the work I'm testifying on today, there were 18 separate applications.
Okay. How many of these applications were made online?
I think about most of them actually began online and then switched to a phone application as we encountered the identity proofing restriction up front.
So all 18 started online?
Most of them did.
Okay. How many of the applicants failed on ID spoofing? How many of these applications failed on ID spoofing?
I would say the vast majority of them failed the online ID proofing step in the application process.
According to your testimony, ID proofing, quote, serves as an enrollment control for those applying online. Is that correct?
That's correct.
And let's see if I understand correctly. Each of these applicants were directed to phone the marketplace and apply by phone, correct?
We were directed to call the contractor, Experian, who is tasked with performing the identity proofing. When they also could not proof our identity, they directed us to call the marketplaces, and that's what we did, and we consider that a control workaround.
Were these applicants informed over the phone that there were civil or criminal penalties for providing inaccurate, untruthful information to the exchange?
As I recall, the representatives did read them statements to that effect, yes.
And are you aware that in addition to criminal penalties for perjury, there are significant civil penalties in statute for negligent or knowingly reporting false information to the exchanges?
Yes, I'm aware of that.
And if I understand your testimony, each of the 18 applications, all of them resulted in inconsistency?
The ones that we were successful, which was 17 of 18, most of those resulted in some sort of inconsistency which needed to be cleared, yes.
And according to your testimony, if there is an inconsistency, the marketplace determines eligibility using the applicant's attestations and then requires applicants to provide additional documentation to resolve the inconsistency. Is that correct?
That's correct, right.
And this is another control in the eligibility enrollment process.
Well, the submission of documentation, we consider that to be more of a middle control. I think the whole system essentially relies on self-attestation, which is a concern itself in an overall control environment.
And GEO submitted forged documentation for each of these applications for coverage?
That's correct.
So, for instance, fake Social Security cards, fake driver's license, fake immigration documents, and so forth?
That's right, yes.
Okay. Are you aware that there are significant criminal and civil penalties under both state and federal law for creating and using falsified documentation, such as driver's license and federal immigration documents?
Yes, I am.
Did GEO at any time contact the Office of the Inspector General for Health and Human Services?
We coordinate our work up front with them, but we don't discuss any of our investigative details.
Okay. Has this report been submitted to the Office of the Inspector General?
No, it has not.
I want to thank you for your testimony. It makes clear that there are multiple layers of eligibility and enrollment controls in the state and federal marketplaces. While there's always room for ideological opposition to ACA seek to falsify or portray the eligibility and enrollment system, I think there are some safeguards in it. But again, we have a lot of different groups that can investigate that, including the Inspector General for the Health and Human Services. And Mr. Chairman, I yield back my time.
Chair, thanks, gentlemen. Now recognize Vice Chairman of the Full Committee, Ms. Blackburn, 5 minutes for questions.
Thank you, Mr. Chairman. And just as a point of clarification as we're having this discussion, I think that it's important to note that having secret shopper programs are standard operating procedure for businesses that work in the consumer realm that are in customer service. Secret shopper programs are used by restaurants, by hotels, by retail establishments. They're used by our chambers of commerce many times. So to say it is fake or that it is something that is unseemly and stealth, I think it's important to know that this is how many organizations go in and do a spot check on how they're performing and how they're delivering a service. As I said, coming from a state where we've had a little bit of a history with this through Medicaid expansion, I appreciate the attentiveness to the detail of trying to make certain there are fewer vulnerabilities within the system where people can come in, fake their eligibility, enroll, and then get services that the taxpayers are paying for, services to which they are not entitled, and their utilization of those services means there is less for those who actually need and deserve and qualify for those services. Mr. Bedoyan, I want to start with you and go back to this vulnerability where you say that it was the documentation submitted does not appear to have any obvious alterations. It would not be questioned in its authenticity. That seems like a very low bar to me. So did fabricating the documentation requested as part of the application process require specialized knowledge or any great technical skill?
Not really.
So this is something that anybody could do from a simple home computer or a keyboard?
Yes, we used commercially available computers, software, and paper materials. You just have to have a basic
So you
knowledge
had-
of what these things look like, and those are readily available from the internet.
Right. So in replicating the marketplace, in order to do your research, you used as many different points of entry as options into the system.
Yeah, we had no foreknowledge of what the controls were that we would encounter. That goes back to our 2014 work. We went behaving as a typical consumer would, encountering the program and the systems it has for the first time.
And that is how any smart business person would do an evaluation of the vulnerabilities and the risk embedded in their system and ascertain as to whether or not the proper controls are in place to prevent any type of fraud or leakage. Let me ask you this. How would you respond to claims that the risk of fraud is low because subsidies are provided directly to the insurer as opposed to the enrollees?
Right. Thank you for your question. In that regard, we view the subsidy issue as still being beneficial financially to an applicant. Essentially, it keeps more money in their pocket when they pay the premiums, or if they choose to take the subsidy in the form of a tax credit that reduces their tax liability, or it could also result in a refund, which does involve getting a check from the government.
Okay, thank you. Ms. Yoakum, just one question before we move on. The 100% federal funding for the newly eligible, the states obviously have a financial incentive to bulk up that enrollment. And what, if any, safeguards did CMS institute to ensure that taxpayers were not paying more than their share of the state's Medicaid program?
The primary safeguard that CMS has been using have been the eligibility reviews that they have conducted. They have asked first for states to take samples of applications and review them, and then they have reviewed the results of those applications.
So the states are following through on the verification?
When errors or problems are identified, then the states need to file a corrective action plan with CMS that says how they will correct those.
Very good. Thank you. I yield back.
Chair, thanks, gentlelady. Now I recognize the ranking member of the full committee, Mr. Plone, 5 minutes for question.
Thank you, Mr. Chairman. My questions are of Mr. Bagdoyan. I want you to understand, Mr. Bagdoyan, why I'm being so critical of this fake shopper investigation. And I know that the GAO is spending a lot of money doing this investigation, and it just seems to me that it's not a priority. I mean, my colleagues on the Republican side every year try to cut funding for the IRS. And, you know, you'd think that the people that are cheating the income tax would be the ones you'd be most concerned about defrauding the government. But they keep cutting the enforcement dollars for that. So it's always a question of priorities. Who is it that asked you to do this, this fake shopper investigation?
Yes, as we reflect in my statement, Mr. Pallone, this request originated with the Senate Finance Committee, the House Committee on Ways and Means, and the House Committee on Energy.
I know a lot of times people ask, you know, in Congress, if members, committees ask GAO to do investigations, they don't do it. Why did you think this was a priority?
Well, actually, we do respond to each and every request.
You respond, but you don't necessarily do it.
Prioritize them, and when the turn of this engagement came, it was fully staffed and the work began.
So you respond, you just basically do every investigation that any congressional committee asks you to do?
For the most part, yes.
Well, I haven't found that to be true. Let me ask you this. You're a government employee, right?
That's correct.
And how do you get your health insurance?
Through the government, through GAO.
Through, well, not through the GAO, but through the federal employee program, right?
Right.
Why did you decide to investigate the exchange marketplaces and not the federal employee program? Why didn't you set up fake shoppers for that?
Well, that was not my decision. It's a response to a request from Congress. We do our best to respond to that, and we operate for this work under the premise that this is the law on the books, and our work is to make sure that it operates as intended.
I understand that, but I also understand that in order to obtain coverage fraudulently, one would need to be extremely motivated, willing to break a number of different laws with serious civil and criminal penalties for no direct financial gain, and I think that's highly unlikely. And, you know, if an enrollee did manage to do all that, they would still have to pay their share of premiums before their coverage is effective. And you never even went so far as to ask for their income taxes, which is the final check. So I just think that when you make decisions about what you're going to prioritize and investigate, you've got to think about what the documentation being used in the marketplaces. In other words, how big a problem this is in reality. Is that something that you've looked at as to what extent this is a real problem?
Sure. Thank you for that question. As I mentioned earlier in response to another question along those lines, we have parallel forensic audit work that is looking at all the enrollees from coverage year 2014, and we're in the process of requesting coverage year 2015 data, and we'll subject those data sets to various sorts of analysis.
But to this date, we have no information to tell us how big this problem is.
That's correct, yes.
Okay. All right. I just think that it's important when it just disturbs me a great deal to think that what you're basically telling me is that anything Congress asks you to do, no matter how spurious it might be, no matter whether or not you think it's important or not, you're just going to do it because Congress asked you to do it. I mean, if that were the case, there would be no real-world applicability to what you do. And it's shocking to me to think that you had to, every time someone went up and there was a check in the marketplace for someone who was trying to be fraudulent, you had to go and make another false identity each time. And then finally, when you got to the point where they would have to submit their tax returns, you didn't even bother to do that, which probably would have been the ultimate check. Why didn't you ask for the tax returns? Why didn't you go to that ultimate check?
This part of the work was designed to take our checks or control reviews to the middle part of the controls, which essentially ends with the document verification.
So in other words, is it possible you just thought that one would be too difficult for people to accomplish?
No, not at all.
Well, why? And so it's just because you didn't have the time? Basically, you did the middle part, but not the end result.
Each plan stands on its own merits, Mr. Pallone.
Doesn't have any merit, in my opinion, Mr. Bedoyan. I'm shocked. It seems to me that something has to be done about the way GAO proceeds if they just do these things and we have no accountability as to whether it accomplishes anything or is useful in the real world. Thank you.
Thank you.
Chair, thanks, gentlemen. Now recognize gentleman from Illinois.
Good to follow my friend, the ranking member, because the history is also instructive. The health care law was passed, especially the sidecar, with no debate through the committee, no oversight hearings, and really no debate on the floor. So that's why, we on our side continued to look and try to do our oversight. When we were still in the minority, we asked for numerous hearings on how the health care law would work. We asked for hearings on the rollout. We asked for hearings on eligibility standards. We asked to any oversight hearings when we were in the minority. So now that we're doing oversight when we're in the majority, I'm not sure why people should be surprised at that. So, now I'll go to my questions. For Mr. Bedoyan, is that correct?
That's correct.
Has GAO provided such information to other agencies in which similar undercover work has been performed?
Not to my knowledge.
What would be the implications of providing the identities of the fictitious applicants on GAO's ability to conduct future undercover work, whether on the ACA or any other federal program?
Yeah, it would essentially compromise our sources, methods, and techniques. A lot of this information is directly connected to the agents who perform the work, so it would expose them to risk, such as identity theft, and overall, it would compromise our ability to conduct investigations for the current Congress, future Congresses. Those are significant implications. GAO has been doing this for over 30 years, and it's a long-standing capability that we offer, and we pursue them according to the applicable investigative standards.
Right, and you're a professional. I guess the frustration is we're actually on the same team, and we've got a law. We want it to be applicable in the responsible manner. You have a role to help us do that. When I was in the Army and we had the IG coming down, we all, they're here to help us. They were a pain in the rear end, but they were just to help ensure that we had our procedures and our performance standards in line with the expectations of the command guidance in the Army. So no one likes to have people go through their dirty laundry. I get it. But that's your 18 fictitious applicants are not generalizable. In fact, you used that term earlier to another question. I understand that GAO's methodology was not intended to provide generalizable results. Is that correct?
Yes, that's correct, Mr. Shimkus.
And what was GAO's methodology designed to show, and given the results, what has GAO concluded?
Yes, the methodology, as with 2014 and with 2015, was designed specifically to flag potential control vulnerabilities. And in each case, we detected those vulnerabilities. As I mentioned earlier, we have a separate report that will be coming out within the near future that will be directed to all the requesters with recommendations specifically to CMS, and we've discussed those already at a general level with CMS, including the acting administrator.
Great, thank you. And for Ms. Yoakum, do you find it concerning that at a time when states are implementing significant changes to the Medicaid eligibility determination process and the federal government for the first time is determining Medicaid eligibility in some states, CMS decided to suspend its measurement of the eligibility component of its payment error rate measurement program?
We are concerned about that. The eligibility determination rate is not going to be based on the Affordable Care Act and the eligibility actions there. And at this point, I believe the latest is it will not be until 2019 before the error rate is actually applied. CMS is doing eligibility reviews, and it's important to do this. We do want them to be a little more transparent about what they're finding and how they're fixing it.
Thank you, Mr. Chairman. I yield back my time. Thank you for coming.
Ranking member.
Mr. Chairman, and my colleague and good friend from Illinois, you were on the committee when we had exhausted its due diligence in 09 and 10, as I recall, because I was on the committee in 2003 when we expanded the prescription drug plan.
Would the gentleman yield? Would the gentleman yield first?
It's not my time.
It's my time, certainly.
Just for,
sir.
I would ask the public to check the record. I'll stand by my statement.
Thank you again, Mr. Chairman. As some of my colleagues have pointed out, the forensic work that GAO is providing testimony on today is interesting, unfortunately not particularly applicable to the real world. It's highly unlikely that people would use fraudulent identities to enroll in a qualified health plan. The number of hurdles they would have to overcome in order to get coverage, not to mention the number of state and federal laws they would have to break, simply are not realistic for someone who's just trying to apply for health coverage that they're going to pay for with their own premium dollars, by the way, with any subsidies going not to them, but to their insurance company. In sharp contrast to GAO, the work of the HHS Office of Inspector General has been doing to review real-life cases has been far more constructive in finding areas where both the federal and the state-based marketplaces can improve. In Kentucky's state-based marketplace, it reviewed a sample of 45 actual case files, interviewed staff and contractors, and reviewed documents. Mr. Beck-Doyen, are you aware of this report, yes or no?
Yes, I am.
Thank you. The OIG report found that the state's controls were generally sufficient, but did find some issues that occurred primarily due to system errors, such as failing to send a notice of inconsistency, flagging that something is not right. The state has corrected these errors by addressing the problem with the system, and also made sure that the people in the cases with errors were actually eligible, which in fact they were despite the system errors. Similarly, a review of the federally run marketplace in August found some issues in how it resolves inconsistency. As in Kentucky, CMS confirmed that people in the cases with problems were actually eligible and is making changes to improve the process of resolving inconsistencies. The OIG provides specific information on the errors they find so they can be corrected or otherwise remedied. Mr. Beck-Doyen, do you plan to make the identifying information for the fictitious applications available to CMS and to the state-based marketplace in order that these entities address the root causes of the errors, yes or no?
As with our past position, we will not be providing that information.
Why not?
Because it involves investigative techniques, sources and methods, undercover identities that are directly linked to our agents who would then be exposed to risk.
Well, I find this very unfortunate, and I must say, I think this further supports what I've been saying about the real-world applicability of GAO's forensic work in this case. By looking at actual cases rather than wholly artificial ones, the OIG is identifying where there are actual, real-life problems and the eligibility enrollment system that need to be corrected. Their investigation gives states like California, where I live, and the federal government the opportunity to actually improve the way the systems work, and this benefits consumers and taxpayers. In contrast, GAO's work looks at theoretical problems involving fictitious applicants who do not actually operate as people operate in the real world, and then refuses to provide information sufficient for these agencies to make genuine system improvements. One last question, Mr. Begdoyan. You said that the documents forged and produced were deemed with readily available materials. How much money did you need to spend on these materials for computers, printers, or other internals?
Very little to none. Are readily available to us as part of our investigative capability.
At what time, how much time did you spend on this project?
The work's been ongoing since 2014.
This isn't an area suitable expectation for, well, I appreciate that information, and again, it's just unfortunate. Thank you very much. I yield back the balance of my time.
Sure, thanks, gentlelady. Now I recognize the
Where you are on the Affordable Care Act, our people working for state government made a website that worked. It actually operated when a lot of places weren't able to do that. The problem is that in this study that you move forward, and I understand what Ms. Capps is referring to, but those were people who qualified, they just were mistakes made on those applications. My understanding is in your fictitious people signing up that weren't qualified for subsidies, and the way you set up the scenario, that Kentucky had 5 out of 5 get coverage, even though they should not have gotten coverage, so 100%. And I know that's not general, you're just doing 5 cases, but if somebody told me it was 2 out of 5 and that's, the 40%, or if it's 1 out of 5 and that's 20%, but 5 out of 5 is 100%, so who knows, you can sort of start making some extrapolations. Statement, your written statement, Mr. Begdoyan, you said, and I quote, that you state that CMA officials told GAO officials, and I quote, the eligibility and enrollment system is generally performing as designed.
That's correct.
Working as designed is what they said. What do you make of the statement, given that 93% or 17 out of 18 of your fictitious applicants enrolled in subsidized coverage?
Well, I would answer that question in the context of what CMS also told us in respect of balancing access to coverage with program integrity. So if you look at it, that it was designed, it is working as intended, that means that access is enabled. I would say that the overall balance would tilt to access over program integrity at this point in time.
So they're willing to accept that fictitious people can register because it's easier for everybody to register?
That would be for CMS to respond to.
So in your opening statement also, you indicated that GAO found no improvements in the federally facilitated marketplace control environment between plan year 2014 and plan year 2015. When did GAO first share information with CMS about the weaknesses found in the marketplace eligibility determination controls, and are there changes that CMS could have made between the 2-year plans to address these concerns?
Sure. We first broached the subject at the conclusion of our first round, if you will, of our undercover work, which would have occurred in early summer of 2014, right before the July hearing before the House Ways and Means Committee.
Okay.
And in terms of having information from us, we discussed in detail how each scenario unfolded, both in 2014 and 2015. We explained how we worked around the identity proofing control that we encountered and provided related information that they could have used to notice that the ID proofing workaround was a problem, and also the fact that the documents that we submitted were not really subjected to any kind of scrutiny other than did they really look altered to the naked eye. And I would point out, in terms of providing information to others, that we had discussions with Kentucky officials in person
My understanding they're very receptive to try to change
They
their.
were receptive. We, again, provided information. We went to Kentucky to discuss those in person. And in response to the statement, those officials let us know that they're already taking action in 2 areas. One is training of their representatives, and the second one is to improve their system so the ID proofing step or control is not so easily worked around.
Thanks. I'm glad you pointed that out. I should have pointed that as well, that our state employees were trying to make these improvements
That's
based
correct.
on what.
They've been
you reported.
receptive to our discussions and already taking action. And they promised to provide us with additional details when we finalize this work, this 2015 round of undercover work in a final report.
I appreciate hearing that. And then for Ms. Yocum, I have one quick question. 10 states have delegated authority to Medicaid eligibility determinations to the federal government. What, if anything, has CMS done to assess the accuracy of Medicaid eligibility decisions made by the federal exchanges and determine an eligibility error rate?
When we began our work, the short answer is they had not done anything. Our process is pretty interactive with CMS. They have reported to us that they have begun looking at the FFE, at the federally facilitated exchange eligibility determinations beginning in August. We do not know the results of those reviews.
Okay, so they just began this August, and we're waiting to hear. Okay, it'll be interesting to hear when that time comes. Well, thank you, and I just ran out of time. I yield back.
Chair thanks the gentleman and now recognizes the gentleman from North Carolina, Judge Butterfield, 5 minutes for questions.
Thank you, Mr. Chairman, and good morning to both of you. Thank you very much for your testimony. In the interest of time, I think most of my questions will be directed to the GAO representative, Ms. Yocum, but thank you as well, sir, for your participation. Mr. Chairman, I think it is important for us to remember why we have these systems in the Affordable Care Act. Envision a no wrong door policy in which individuals could apply either at the state Medicaid office or they could apply through the exchanges and would get an eligibility determination for whichever program they're eligible for. And so, Ms. Yocum, let's start with this. I'd like to ask you some questions about how the ACA implements this no wrong door policy and what this really entails.
Sure. The purpose of the no wrong door is that an individual can approach a marketplace, they can approach the state Medicaid agency, they can go onto the website, and from any of those areas determine which type of insurance, if any, they are eligible for, and then how much of an, whether they would get a subsidy for the coverage in the event of exchange coverage.
That's what I recall. Is it correct, Ms. Yocum, that people can only enroll in a qualified health plan during open enrollment unless there has been a change in circumstances, such as losing other coverage?
That's correct.
And coverage on a QHP doesn't start until after the enrollment and after payment of the first premium. Is that correct?
That's correct.
And I'm informed that the general rule is that enrollment before the 15th of the month starts coverage in the following month. And enrollment after the 15th results in coverage starting in the month following the month of enrollment. Is that correct?
I believe so, yes.
Yeah, that's my recollection as well. If individuals had to wait to have their attestations verified through review of paper documents, it could result in significant delays in coverage, or they could miss the open enrollment period altogether. Would you agree with that statement?
Yes, there are delays we've identified as potential scenarios, yeah.
All right, moving right along. Under the ACA, eligibility to enroll in coverage through a QHP and to qualify for premium tax credits and cost-sharing reductions is determined on a real-time basis based on the information individuals attest to on their applications, and I might say under penalty of perjury. Verification occurs in real time using electronic data to the fullest extent possible. Ms. Yocum, the eligibility determination process using electronic data through the Federal Data Hub is an important feature of the marketplace that operates to prevent individuals from obtaining fraudulent coverage that they are not eligible for, and even duplicate coverage.
Termination, this is likely to occur.
Do you know of any other systems in the federal government that operates like this in real time and using data sources from across the federal? Verified immediately using electronic data sources, people must supply paper documents within a set time period to verify their individuals are only getting the coverage they are entitled to.
Yes, getting the documentation.
Premium tax credits to ensure that beneficiaries only get what they are entitled to on the back end.
That is the hope. We have done some work, GAO has, that does look at issues with the IRS and the ability to reconcile right now. So, okay.
All right. We said in the beginning, years ago, when we passed the Affordable Care Act, and we continue to say today, it's not perfect, but we're going to continue until it reaches perfection. I thank both of you for your testimony. I yield back.
Chair, thanks, gentlemen. And now I recognize the gentleman from Florida, Mr. Bilirakis. 5 minutes for questions.
Thank you, Mr. Chairman. Appreciate it very much, and I thank the panel for their testimony. Mr. Badayan, under federal law, an individual who has access to affordable minimal essential coverage through their employer is not eligible for the subsidy on the exchange. Based on GAO's work, what are the federal and state exchanges doing to assess whether an applicant has access to employer-sponsored insurance before providing them a taxpayer-funded subsidy?
Thank you for your question, Mr. Bilirakis. For the scenarios we conducted, I believe there were 4 of those instances. We did not detect any activity between the exchanges and the employer.
Thank you. Another question for you, sir. Are you aware of any actions that the federal and state marketplaces have taken in response to your findings?
The federal marketplace has not, to our knowledge. As I mentioned, we detected no changes in the control environment between 2014 and 2015. At least 2 of the states we spoke with, as I mentioned to Mr. Guthrie, Kentucky is one of them. They gave us specific information as to the actions they are currently taking, as well as the California State Exchange. We had an extensive discussion with them, and they provided us with an overview of what they are doing and plan to do, and they promised us additional details to include in our final report on this.
So the states have been able to make changes in response to your findings in just a few months, but CMS has not made changes even though they had more than a year. Is that correct?
That would be one way to characterize it, yes.
Thank you. Ms. Yoakum, you indicated that states raised concerns about the quality of Medicaid, eligibility assessments and determinations made by federal exchanges. What actions did CMS take to review those assessments and determinations?
They have, the short answer is at the beginning of our work, they had not done any. They did, in response to our recommendations, say that they were going to begin conducting reviews of the facilitated exchange ability to determine Medicaid eligibility, and they've conducted reviews in 2 states so far.
What types of errors were identified, and what were the causes of those errors?
Most of the errors were related to income verification. There were training issues where the individuals who were doing the reviews were not doing them correctly, so there was a need to train staff. And then the last issue does have to do with transferring the applications and the application information between the exchanges and the Medicaid programs.
And no corrective action has been taken. Is that correct?
At this point, the CMS has taken some actions, but none that we would consider sufficient to address the concerns.
Okay, thank you very much. I yield back, Mr. Chairman.
Chair, thanks, gentlemen, and now recognize the gentleman from Oregon, Dr. Schrader. 5 minutes for questions.
Thank you very much, Mr. Chairman. Appreciate you all being here. I want to get a little perspective, I guess, with the degree of fraud that we're worried about. Ms. Yoakum, do you have any expertise or any background in what the fraud has been historically in Medicaid or Medicare?
There really isn't a good estimate of fraud. There's estimates of improper payments, and the Medicaid rate.
What would those be?
It's about 7%, if I remember correctly.
Okay. In both programs?
For Medicaid, Yeah, it's, I do not know the number for Medicare.
Okay. Medicare, it's about same. It's somewhere between 5 and 10% in the literature. And then private insurance, which is what we're talking about with regard to the QHPs. It's a marketplace. Your own report refers to marketplaces. What's the fraud generally in those?
That is not known.
Well, there is actually estimates that we've been able to get in the 1 to 1.5% range.
Would that be fraud or improper payments?
Improper payments.
Improper payments.
Improper
Okay.
payments. So I'm trying to get at the whether or not it will keep this whole thing in perspective. It would appear to me, based on the information that's out there, that improper payments and fraud are less in the marketplaces where private enterprise has some incentive, obviously, to monitor what's going on. And as has been alluded to here today, with the advent of the Affordable Care Act, there's been an emphasis on access. Mr. Bigdoyan, are you surprised at all that CMS would perhaps lean a little more towards access versus program integrity as they roll the program out?
Well, obviously, Dr. Schrader, that's a policy call that CMS has made, and that's a defensible position from their perspective. The balance, as I said, clearly tilts towards providing access, but we also like to emphasize that program integrity is very important.
Certainly that would be your job, and I appreciate you doing your job. But
Right.
I don't think it's astonishing to any of us that access is extremely important to make sure these people that haven't had health care in the greatest country on earth, most industrialized nation, should at least be able to get a little bit of health care. And there is obviously personal responsibility because they do have programs. Contrary to some of what we've heard today, there are ways and procedures by which Medicaid does check or recheck authentication. Isn't that correct, Ms. Yocum?
Yes, that is correct.
Yeah, it's quarterly or whatever, as I understand.
They're doing quarterly reviews right now.
So there is a way, even though someone could, a determined criminal, as we've established, your shoppers are very determined, can defraud the system. They can. I think that's pretty commonplace in anything in America, unfortunately. But there is this way to catch them on the back end. And then with the QHPs, there is the annual check with the IRS documents. Is that correct also, as a way to check on the eligibility?
That is correct.
So we've got a system that's not perfect, but obviously there are some initial checks. That was the ranking member alluded to that, and was Mr. Bigdoyan, and you responded. So there's some initial checks. There is the review down the line. So it's not quite as profligate a system as some would paint it. Can it be better? I think the answer is absolutely yes. Is there a current program, trying to get at the nuts and bolts? The biggest issue I see coming forward is the Netherland between Medicaid program and QHP program, as people move up or down the food chain with regard to their wages. Is there currently in place an opportunity for program integrity to check into that besides just the year-end checks?
There is. Conducting reviews of the eligibility determinations that are made, not just in the states, but also in the federal marketplaces, is a good place. The other really key issue is, at this point, CMS is doing eligibility reviews, but then they're also doing expenditure reviews, and they need to connect those two together so that when they do identify errors, they can make sure that the matching rate is correct.
And if I was to interpret your comments, maybe Mr. Bigdoyan's too, it's the two programs talking to one another, the Medicaid and the QHP programs, for lack of a better terminology, that we could work on. Yeah. And last comment I guess I'd make is, as I understand, while the states have been responsive to some of the concerns that GAO has come up with, CMS, at least within this last year, did not find time or have the interest to perhaps do that. You'll be monitoring this going into 2016, I assume, and we'll get a report. And from your understanding, CMS is more responsive now, perhaps, than it was a year ago in terms of some of the concerns you have?
They have been with our recommendations, yes, and we've had good conversations with them about specific ways that they could adjust their processes.
Good. Well, I look forward to a healthier report next time, and appreciate all the access that's been created and your hard work in making sure it's going to the right people.
Thank you,
sir.
Gentleman yields back. Chair now recognizes the gentleman from New Jersey, Mr. Lance. 5 minutes for question.
Thank you, Mr. Chairman, and good morning to the panel. As I understand it, CBO estimates that exchange subsidies and related spending this year is roughly $77 billion, and next year the exchange and Medicaid-related spending may increase to $116 billion. Given those very large amounts of money, even a small sample involves a significant amount of money. Would that be accurate, Ms. Yocum?
Yes.
Yes. And so I think that it's relevant in our discussion here today that we are investigating, through your fine offices, significant amounts of taxpayer funds. As you mentioned in your testimony, many low-income individuals are likely to switch between exchange coverage and Medicaid eligibility due to income volatility. Could you explain to us when and how is an enrollee notified that he or she is eligible for a different type of coverage, and can you walk the subcommittee through the process for an enrollee transitioning from one type of coverage to another?
Sure. At this point, the primary way that a change in coverage comes is the enrollee reporting a change in circumstance. So an individual who is on the exchange perhaps loses their job and no longer has coverage and then goes to apply for Medicaid. We have 3 scenarios in our report that look at the potential for gaps and for duplication. The gaps have to do with the individuals failing to report a change in coverage, or they're being enrolled in both places at once.
And is this a complicated system for the person likely involved in these programs to navigate?
I would say there's a lot of complication, yes.
Thank you. Mr. Chairman, I yield back the balance of my time.
Chair, thanks, gentlemen. Now recognize the gentlelady from California, Ms. Matsui. 5 minutes for questions.
Thank you, Mr. Chairman. I want to thank the witnesses for coming here today. Mr. Bagdoyan, I'd like to ask you a question regarding the use of self-attestation. I think I'm pronouncing it right? Attestation in the marketplace application process. When applying for coverage, a consumer may self-attest, for example, that their income is a certain amount under the penalty of perjury. In layman's terms, lying on your self-attestation is against the law and subject to criminal penalties. In your testimony, you describe in detail the processes that were used to maneuver fake identities through the marketplace system. In order to work through the system, the agency had to provide an attestation as to the accuracy and truthfulness of the application. Is that correct?
Yes.
Now, last July, when you testified in front of the Senate Finance Committee on a similar secret shopper study, you had an interesting exchange with Senator Portman. In that exchange, you stated, "We were able to get through via self-attestation," and further went on to say, quote, "We would view that as a control gap." For the record, would you acknowledge you made that statement?
Sounds about right.
Just for the record, I'd like to read the attestation that the secret shopper signed. "I'm signing this application under penalty of perjury, which means I provided true answers to all the questions on this form to the best of my knowledge. I know that I may be subject to penalties under federal law if I intentionally provide false or untrue information. This is attestation that the GAO encountered. Is that correct?"
I believe so, yes.
Mr. Bagdoyan, I'm sure you filed income taxes in the past. Do you recall signing your name after reading the following phrase? "Under penalties of perjury, I declare that I have examined this return and accompanying schedules and statements, and to the best of my knowledge and belief, they are true, correct, and complete." While I understand the limitations of a self-attestation system, it's been proven over time that self-attestation tied to audits and penalties is the best viable option. In fact, on its website, the IRS has the original 1040 form on display. Interestingly, it was introduced in 1913, and yet over an entire century later, the self-attestation is essentially unchanged. While the system isn't perfect, no system ever is, it's been proven over time to be the best viable option, and I've yet to hear widespread news reports denouncing the use of self-attestation in the tax system. While I welcome the GAO's suggestions on this topic, I'll respectfully decline to ask any additional questions since the GAO has not yet finished its review process, nor have they issued formal recommendations yet. And with that, I yield back the balance of my time.
Chair, thanks, gentlelady. Now I recognize the gentleman from Missouri, Mr. Long, 5 minutes for questions.
Thank you, Mr. Chairman, and I'll stick with you, Mr. Bagdoyan. Based on your written statement, it appears that in several instances, the exchanges accept applicants' self-attestation as sufficient evidence. Can you describe the instances where the only evidence provided was applicant self-attestation?
Well, I think all the information we provided on the applications, on the phone, for example, and then confirmed with submitting documents to that effect to verify that the information we provided was indeed accurate, would be in the broadest sense process of self-attestation. We provide the marketplace reviews the documents, checks what we said on our application against what they have in hand in terms of a document. If they don't see an alteration, they accept the self-attestation as the truth.
Okay, and do you think that relying on this self-attestation is sufficient?
It is probably not sufficient on its own if the document is accepted at face value without any further check. That would be a material weakness.
And how often do you think that is done?
I'm sorry?
How often do you think that's done? That it's accepted without any further checking?
Sure, yes, that's a fair question. In the 2 rounds of Undercover that we performed, we are not aware of any kind of a cross-check between any of the parties, either the exchanges or the state-level agents.
In July, the CMS was to conduct a data match to identify consumers who may be dually enrolled in Medicaid and marketplace coverage. Do you know what the results of this data match were and how frequently CMS plans to conduct such matching?
We do not know the results of that data match. My current understanding is that CMS is conducting quarterly reviews, but they are still in the process of determining how frequently they will do them.
Why do you not know the results?
They just have not been provided. At that point, we had a time period that was earlier than that, so.
What do you mean earlier than that? I mean, this was back in July.
Our coverage period that we were investigating did not include July. CMS offered that as additional information, but told us they were still analyzing the results.
Coverage for both the beneficiary and the American taxpayer. What is CMS doing to prevent such duplication from occurring?
We think there's more to be done. They are taking some actions. They are starting to do these reviews, but there needs to be more review of the determinations and more cross-checking across the exchanges and the Medicaid program.
Okay, but apparently it'll take more than 90 days to get the results, I guess, from what you've said here today. So Mr. Chairman, I yield back.
If I may, Mr. Chairman, I would like to pick up on
You may respond.
Mr. Long asked earlier. One instance of an agency actually checking with another entity as to the validity of some of the information we provided. There was a state agency that approached the Social Security Administration to double check about the validity of a Social Security number. The SSA advised the state agency that that could not be a valid Social Security number, and the agency nevertheless proceeded to approve our application. So I just wanted to make sure that you had a full picture on that one.
All right, the gentleman yields back. Chair now recognizes the gentleman from Maryland, Mr. Sarbanes, 5 minutes for questions.
Thank you, Mr. Chairman. I thank the panel. It's pretty clear that the process of eligibility verification, sort of going between these various systems, is probably one of the most complex that any agency or group of agencies would have to manage. So I'm impressed that it can be done for the most part as effectively as it is being done, and I understand that that CMS is taking steps to respond to some of the recommendations and findings of the GAO's report to refine the policies and procedures. I wanted to ask you, Mr. Bagdoyan, you said that I think there was 18, were there 18 application submission process, which was largely online, I guess. You said there might have been a couple that were conducted by phone initially, but the online ones, the system of checks and balances did pick up some issues and rejected them at that point, right?
That's correct. Yeah, the online application process to call the contractor, which is Experian, whose job it is to offer.
So that's pretty good that you failed on at the beginning.
At the beginning, the story gets a little bit more complicated.
So we give a plus sign to the system for failing you.
And then
at the front end.
We failed through the contractor, who then directed us to
So you failed twice.
Exchange. Right. We
failed
called the exchange.
So the system caught you out twice.
Initially, yes.
Initially. So that's pretty good because you then came back with, I guess, paper submissions.
In one instance, yes, and then by phone on most of the other ones, and that's where the workaround and the control weakness occurs, is that we use the system's own instructions to overcome its initial control.
Right, but you're going in there pretty well versed in kind of where to poke at the system to find these potential weaknesses, right? I mean, you've got more, I would presume, given your forensic experience, you're going to have more knowledge than even a fairly sophisticated person out there who's intent on committing fraud as to where some of the weaknesses are, so you can kind of poke at them. And I commend you for the heroic efforts which your people apparently undertook to explore all of those various weaknesses.
Yeah. If I may respond to that, when we started the work in 2014 for coverage year 2014, we had no idea what we would encounter. We were designed to act as typical consumers who got online, did whatever was instructed to do, went through the various steps, and when we reached the identity proofing step, we were caught or flagged, if you will, referred to the
but let me just interrupt because
the contractor.
Unless you're going to tell me that the that your folks are subject to the perjury penalties that apply to somebody who checks that submission box after reading the fact that they're and I presume that you have some kind of immunity.
Yeah, it's part of our investigative authority.
Yeah, you have. So you're not. So they're just blowing right through that check in terms of the deterrent effect that it might have, right? Because they're reading this thing and saying, you know, you're subject to penalty of perjury, and they're saying, well, obviously, as the investigators doing the secret shopping, that's not going to affect us at all. So actually, one of the most important things that operates on the typical applicant to give them pause, particularly if they're going through 1, 2, and 3 stages of submitting false documents, is actually not operating in this instance. So to draw conclusions about the ability of this system of checks and balances to actually deter that kind of fraud, I think, from this exercise is a little bit questionable. And with that, I would yield back.
Chair, thanks, gentlemen. And now recognize the gentleman from Indiana, Dr. Bouchon, 5 minutes for questions.
Thank you, Mr. Chairman. Thank you for being here. And I think I just want to point out it's unfortunate that some today in the hearing have gone after the messenger rather than listening to a message they may or may not want to hear, including occasionally discussing your own personal lives, which I find unfortunate. Because clearly you're not here to keep people from getting benefits, but to make sure that people that are actually eligible for those, and I appreciate that work. Mr. Bagdoyan, according to CMS, when an applicant information cannot immediately be verified, the system is to notify the agency of inconsistencies so they can be addressed later. after eligibility is granted. Presumably, all of your fictitious applications should have resulted in generation of inconsistency notifications. Did the marketplaces follow up with your applicants?
Correct. It's more extensive than others, but in general,
So in general, there was
our coverage
communication.
was sustained over time.
Okay.
Yes.
So also in your statement, you indicate, and some of this has been kind of answered, but that 4 of 8 applicants who applied for the Medicaid in your test here, Medicaid coverage were not enrolled in Medicaid, but were able to obtain subsidized exchange coverage. And while this could be seen as a positive sign that Medicaid eligibility determinations are working, and it could mean that at least some of the applicants were unable to get Medicaid coverage, not because they were deemed ineligible, but because of coordination problems between the federal exchange and Medicaid.
Yeah,
Is that
would-
correct?
Yeah, that would be the top line story there. Coordination involves exchange of information, exchange of data files, and that sort of thing that without knowing what was going on the other side, we can only surmise that the failure to exchange information at least an adequate level prevented us from getting a determination. And since we were pursuing coverage, we decided to represent ourselves as having failed to obtain Medicaid and subsequently qualified for a QHP.
Okay, Ms. Yoakum, you have anything to add to that you haven't already talked about? Okay. Well, I mean, I don't have any more questions, but I'd just like to say that whatever the level of fraud is, the people that I represent want to make sure that we're not wasting their hard-earned taxpayer dollars. So I think that some of the implication that this may be a minor problem that shouldn't be looked into because the dollar amounts or the level of fraud may be low, but when I talk to the people that I represent, I'm sure they don't want their taxpayer dollars going for any fraud in the system. And I recognize there are challenges and there are some things that you don't have the staff or the time to investigate. But I think your work's very important. I think that any level of waste of the taxpayer dollars is important, and I appreciate your work. I yield back.
Chair, thanks, gentlemen. Now I recognize Mr. Lujan, 5 minutes for questions.
Thank you very much, Mr. Chairman. And when were your findings presented to the committee?
I'm sorry.
When did GAO send your findings to the committee, to the majority, to the minority? When?
The statement was provided, I believe, mid-morning on Wednesday.
Your testimony was provided?
Testimony, yes, and we briefed staff the week before.
You briefed staff the week before?
That's correct, at their request.
Were there any other documents before your testimony was submitted to the committee on Wednesday? Were there any other documents submitted to the committee before you met with them a week ago?
This was an extensive oral briefing, and I assume notes were taken.
And so when you work with your staff, Mr. Bagdoyan, to prepare for interviews with other individuals, would you say that more time or less time is better for you to be able to review documents before we get a chance to question?
In general, I would say more time.
Would it surprise you that the committee didn't receive information, the minority didn't receive information until 2 days prior to the hearing?
Oh, that's a good question, Mr. Lujan, but I followed the committee's rules as presented to me. That's
well, I appreciate you doing that, but maybe we can all make sure we get the information to spread around so we can better prepare. I appreciate that, sir. Mr. Bagdoyan, so the way that I understand it, GAO used the federal government, so you used your knowledge about the documents with fraud prevention safeguards that were put in place to be able to look into this process with Medicaid coverage and into the marketplace, correct? And so through your investigation, GAO falsified identities to get coverage?
That's correct.
Did GAO, with each false identity, did you enroll into multiple marketplaces at once?
There was one instance where we obtained coverage in additional.
Not obtained. Did you apply? Did you try to enroll multiple marketplaces at once?
Applied and obtained, yes.
And did GAO pay multiple premiums for coverage as this was going through the process?
That's part of the investigation.
Do you think that an everyday person would pay multiple premiums to try to get coverage?
I can't speculate on that, sorry.
I think it'd be challenging for an individual maybe to be paying multiple premiums, multiple areas.
Right.
It's just a question.
If I may
I guess I
clarify,
would say.
yes, that's an excellent question. If I may clarify, that particular scenario was designed to see whether the issue of identity theft would come in. So that's the specific scenario.
Well, let's talk about identity theft. So, under penalty of perjury, these documents were submitted,
That's the upfront penalty, yes.
but GAO is exempted from that, as we found out from
As part of
outside
its
the question.
investigative authority, that's correct.
So an everyday person that, in this case, would, I guess, assumption would be made that if they paid multiple premiums for coverage, that they would still waive the penalty of perjury and be subject to between $25,000 and $250,000 in fines. Is that correct?
That's the case, yes.
Does GAO assist in any investigations to go after perpetrators of fraud with any of our agencies?
That's an excellent question. We do, as a matter of course, whether it's an investigation or an audit, we do make referrals to the appropriate Office of Inspector General or as appropriate to the Department of Justice, or both.
During this investigation, did you identify any fraud?
Not on real individuals, no.
Not on real individuals.
That was
Appreciate
not, that was not designed as such in the beginning.
I appreciate that. And
Sure.
and it was in fact that the 14 secret shoppers that went through the online parameters were stopped, that worked.
The initial ID proofing, as I told Mr. Sarbanes, yes. But eventually we found a workaround without having foreknowledge.
And did the workaround include ignoring the filing under penalty of perjury?
Yes.
So no one that submitted these false documents will go to jail?
Right.
Because there's an exemption.
That's correct.
If a normal person outside of being exempted under GAO would submit these documents and they got caught, what would happen to them?
They would probably be subject to the terms of whatever, whether it's the fine or...
$25,000 to $250,000 in fines and jail time, potentially. And so, Mr. Chairman, I appreciate this hearing, but I hope that we get all of the facts put on the table, but that we also get the recommendations that GAO has made to CMS and to others presented to us. So that way we can work on those together. And I'm hopeful, Mr. Chairman, that as we do this, there's agreement with all of our colleagues to make sure we improve this process as opposed to trying to find a way to try to kick everyone off the rolls, including the 423,000 individuals who were caught, whether it was through mistakes or whatever may have been done through this process, that were removed from getting coverage in the marketplace. I thank you very much, Mr. Chairman. I yield back my time.
Chair, thanks, gentlemen. Now I recognize the gentleman from Virginia, Mr. Griffith. 5 minutes question.
Thank you very much. I've found this discussion interesting. I would say, Mr. Bagdoyan, I hope I said that correctly. I would say I kind of wish you had brought up earlier. I do appreciate Mr. Sarbanes and others bringing up that you all have immunity, but the first couple of times it came up, you know, was this done knowing that there was penalty of perjury? It sounded like y'all were engaged in criminal conduct. So I'm glad we got that clarified, and obviously in order to do an investigation you would need such immunity from prosecution for doing that. Now, my background, which you probably don't know, is that for 28 years I practiced small-town practice of law. The great predominance of that over the years was in the criminal defense field. Having represented a number of criminal defendants, I can assure you that, and you're probably aware as well, that there are numerous people who ignore the perjury clause on all kinds of federal documents, including IRS documents. Wouldn't you agree that that those people who are larcenous in nature are likely not to pay much attention to the prospective penalties?
Yeah, I would say if they have intent, they would probably just...
They would probably disregard that. So when folks say, yes, but they had this, they had to sign off on this statement that you didn't have to worry about, or your secret shoppers, so to speak, didn't have to worry about, that does not, in my experience, bode as a great impediment to going forward if you have a larcenous intent. Likewise, if they have not previously been involved in the criminal justice system, while the maximum penalties, jail time and up to, I think it was $250,000 fine, may sound fairly stiff, a first-time offender is not likely to get anywhere near the maximum and is unlikely in a crime of this nature to receive jail time. Would you not agree?
I don't really have an opinion on whether that would happen.
I did find it interesting that they wanted to point out that there were places that there was a stop, but it was a temporary stop, and you were very good to point out that I've heard folks complaining about how they didn't get it in time. I've read it while I've been sitting here this morning. But I noted that in one spot in particular interest that you all gave Social Security numbers that were impossible Social Security numbers.
That's correct.
They didn't match up with anything that would possibly be used.
They would not have been issued ever by Social Security Administration.
And for the 10 undercover applications that use these numbers that would not possibly have been involved, only one picked up as a trigger, and that was in the state of Kentucky. And yet, even though, as I went through the material, even though Kentucky picked it up, they did give them coverage anyway, and said, well, help us figure out this impossible Social Security number, but we'll give you coverage in the meantime. Is that accurate?
That's correct. And they did contact SSA. SSA said that's not a good number, and whoever the representative or the specialist was overrode that advisory and provided coverage.
And provided coverage anyway. And also, when the fictitious applicants, I think there were 4 of those, who said that their employer did not provide the minimum essential coverage, there was no check back to see with their employer if they, in fact, did qualify for an employer who did not provide the minimum essential coverage. Is that also accurate?
That's correct. We set up a fictitious company for that purpose with contact information, and we got no hits.
Yeah, that's the kind of thing that this hearing's about, and it's troubling to a lot of us. Whether you like the program or don't like the program is not the issue. The issue is, if we're going to have a program at the federal government level, let's at least have some tests out there and some check.
Thank you.
Chair, thanks, gentlemen. Now I recognize the gentleman from Massachusetts, Mr. Kennedy, 5 minutes for questions.
Thank you, Mr. Chairman. I want to thank the witnesses for their work and the work that they do. I think I can say, echo the comments of all of my colleagues when in need of these benefits and services are getting the services that they need, particularly when it comes to something like access to health care. I want to build off the exchange of a couple of my colleagues, but first, Mr. Begdolian, I just want to make sure that I have your testimony clear in my head. We've talked through a number of front-end procedures, identity proofing, and document requests already, and to reiterate, online applications for the secret shoppers were caught and flagged. But let's talk about the back-end side, if you can. So for the fake applications that were created and received initial QHP coverage, getting those records squared with tax returns, and that last check was not done, right?
That's correct.
So did you know that any discrepancy will have to be repaid in full if there is a discrepancy paid by the beneficiary back to the federal government at the end?
Yes, we had that awareness.
Okay. And were you aware that the state Medicaid programs are required to also go through extensive eligibility redetermination process annually as well?
Yes, in general terms, yes.
So the process actually works sometimes too well, and we are unintentionally disenroll eligible beneficiaries. But I can also tell you that from my own state in Massachusetts that it definitely works, this check, as an additional protocol and an additional control. I want to touch base a little bit on the documents that you talked about earlier with response to some of the questions my colleagues asked. You said that your team was able to produce those documents with supplies and equipment that is readily available. Is that right?
That's correct.
And you system, right?
That's correct.
How many folks are on your team, sir?
My mission team has about 55 staff.
And how average education level?
Most would have masters or above.
And how much time did you spend working on that workaround?
On the workaround itself, that occurred in real time. So we just followed the instructions of the system in real time.
But you have a team of 55 people, the majority of whom with master's degrees, with the resources of a fully, at least I should say somewhat partially, resourced federal office to actually attribute this workaround, which is not necessarily the, one would say, potentially the reflection of the average resources, education level, or teammates of your average U.S. constituent.
Not all 55 worked on it at the same time. I wish they had, but it was a much smaller team of less than half a dozen, basically.
Still a half a dozen folks with master's degrees and those resources. Fair?
Fair.
Okay. So now, and most of them have a background as being professional investigators as well, yeah?
The people who actually do the work, they are investigators.
So we're talking about a half dozen folks that are professional investigators with the resources of the federal government trying to do this.
That's a fair representation.
Okay. Now, we talked about it a little bit before with my colleagues, the fact that you, all of this was done underneath the pains and penalties of perjury, and you went through the fact that those include potential civil fines and potential criminal liability as well, right?
That's correct.
So what I guess I'm trying to understand is, sir, we're talking about the fact that there are, and you conceded in the first page, or at least of the summary sheet, that the fact that this was done for a number of individuals cannot actually be accurately generalized. The results of the finding cannot be accurately generalized to a larger population.
That's correct.
But the concern would be, obviously, that there are a large number of individuals that could be using false documentation in order to get coverage.
That's the control weakness, yes.
So just so I'm able to understand, the concern is that there would be tens of thousands or hundreds of thousands of individuals in this country that are willing to risk the pains and penalties of perjury, $25,000, $250,000 fines, plus potential criminal liability in order to get access to affordable health care coverage?
That's the risk.
That's the risk.
That's correct.
And are you aware that in about another half hour, this body is going to vote to repeal the Affordable Care Act for the 61st time?
I didn't know that.
So we are having a hearing which is critically important to examine program integrity. And we are trying to focus on the program integrity while we recognize the fact that there are tens of thousands, potentially hundreds of thousands of folks, which is the concern of this report, that are willing to risk these liabilities in order to get access to affordable health care, the very program that the majority is trying to repeal for the 61st time in an hour. I yield back.
Chair, thanks you, gentlemen. Now recognize the gentleman from New York, Mr. Collins, 5 minutes for questions.
Thank you, Mr. Chairman. And I'm sitting in this last chair, informational hearing, meaning bipartisan. So I have to tell you, I've sat here and listened to the comments and questions, and I'm somewhat befuddled that here we are having a hearing on what I think of as being waste, fraud, and abuse. I always thought those kind of hearings and trying to identify problems didn't have a partisan take to it. So I just would start by saying I'm extraordinarily disappointed in the other side of the aisle here in trying to take away from your hard work on just identifying potential problems to save the taxpayers money in what we call waste, fraud, and abuse. So personally, I thank you for what you've done, and certainly know you're doing your best every day to then take these recommendations back to CMS, your control vulnerabilities. The controls didn't work. So just a couple of, just common sense, interesting questions here. Since these were fictitious Social Security numbers ultimately got through, did these individuals ultimately sign up with these totally bogus Social Security numbers and effectively obtain coverage? Is that the primary identifier of a policy, the Social Security number?
It's not a condition of eligibility, but it is identity proofing, yes.
So I will say, just as a member of Congress and as an American, I am befuddled that in the era of big data, that ultimately somebody gets a policy with an identifier that couldn't exist, and that there's no cross-checking. Again, the big data world that we live in, I am somewhat astounded that vulnerability exists. Oh, that should be an immediate disqualifier. So I'm very not happy to hear you tell us that, but I would think that should be something that could be easily, on the recommendation side, a cross-check into the Social Security data files would eliminate that piece of it. Now, the other thing, if someone's on Medicaid, they don't pay anything, correct? And if this was an expansion, the states don't pay anything. So this is 100% on the federal government's back. If an individual ends up on Medicaid under certainly the expansion portion, and so I'm worried about the individual who works for a small business, who provides coverage. That individual under certainly the expansion of the poverty level would qualify under Medicaid, legitimately qualify. They have their own Social Security number. They are who they are. They live where they live. Income records would indicate they meet all the criteria. But if they sign up on their employer plan, they have to pay some percentage of that coverage, whether it's individual or family coverage. But if they can come in under Medicaid, then they don't pay anything. So my worry would be back to somebody saying that they work at XYZ company, but XYZ doesn't provide health care coverage. So they are not being honest in that regard. And therefore, I'm concerned what you're telling us. I think there was no cross-checking back on that piece. So somebody who low income wants coverage but has an employer providing it is cheating or being deceptive in saying, no, my employer doesn't offer it, therefore they get it. Is that some of the scenarios you
Yeah, the
tried?
scenario itself was the applicant claiming that whatever the employer did provide did not meet the minimum standards, so they were seeking better coverage. And as I mentioned to another member earlier, we did set up a fictitious company for that very purpose with contact information. And as I mentioned, we did not get a single hit for verification purposes.
So just, you know, again, back in me initially thinking this was going to be a bipartisan informational hearing, I think a couple of things is the Social Security check should be a no-brainer, but secondarily, a very big issue of potential, and we'll use the word fraud, but this is a low-income individual trying to get coverage at no cost, but happens to much a real life scenario that could happen that should be addressed in some way through that verification of somebody suggests that their company doesn't meet the minimum standards. Somebody should check on that. That's, I'm assuming, what a recommendation might be.
That's the intent of the check, yes.
Yes. Well, thank you all for the work you do on behalf of the taxpayers. And with that, Mr. Chairman, I yield back.
Chair, thanks, gentlemen. Now I recognize gentleman Mr. Cardenas, 5 minutes for questions.
Thank you very much, Mr. Chairman. A question to Mr. Bagdoyan. Are you familiar with the term presumptive eligibility?
In general, yes.
What we're talking about today, is this a program that has presumptive eligibility, or is it something that people have to properly and appropriately identify that they can or should be eligible before they actually receive their benefits?
Yeah, it has to be confirmed that they have eligibility. They've met all the requirements of the application process. They've submitted documents to clear any inconsistencies that were created as part of that.
So it appears that what we're discussing today isn't so much whether or not the Affordable Care Act law in and of itself encourages individuals who are not eligible to apply, receive services, and then after the fact, perhaps be found out that they were not qualified.
I presume the law would not encourage that to happen.
Correct, because it's not a presumptive eligibility. Presumptive eligibility is not part of this law, correct?
That's my understanding, and as I mentioned earlier, CMS told us that they had to balance, the agency had to balance access with program integrity. We see, based on our work, that access has a tilt in its favor at this time.
Okay, so would you say that it is being utilized as a presumptive eligibility program or not?
That type of analysis was not within the scope of our work. Our scope included testing controls
Sure.
as part of the
Okay,
overall environment.
So let me ask this question. So are there some effective controls in the process that, due to your research and your analysis and your efforts?
Right. As I responded to questions from members, and as some members pointed out, the first step of the application process involves something called identity proofing, and that flag we failed to clear online, and then we failed to clear it with the contractor as a next step. But again, following the system's own instructions, we were able to work that around that control by engaging in a phone application.
Okay, so by and large, based on what you've been able to uncover, is it a failed system or a flawed system of identifying who or is not eligible?
In terms of failed and flawed, there are weaknesses is the best way to describe it.
Okay, so that's more in the genre of flawed rather than failed.
At the
wouldn't you
time.
say? Based on what you've been able to
Based
glean
on what
from
we've
your
done
efforts?
so far, right. And the forensic aspect of our work would give us a better idea whether it's a failed or flawed or perfectly working system.
Mhm. And who's in charge of doing that forensic analysis of your work?
That's done under my direction as well.
Okay, and when will you have that done?
We are working on it. We received the data set from CMS for coverage year 2014. We're in the process of assessing whether the data are even reliable for us to make our analyses. If they are not, we won't be able to proceed. If they are, we'll go ahead and do that, and we expect results, assuming we can proceed, sometime next year.
Mhm. Do you feel comfortable that the amount of resources that were made available to you and the budgetary decisions, et cetera, on this effort that you embarked on, was it robust enough for you to feel confident that you could go out there and do enough work so that you could eventually get to the forensic analysis and have a strong conclusion? Okay, so you felt comfortable that the amount of resources that were made available to your department, you were able to bifurcate those resources into the effort that you put together was good enough, big enough, funded well enough?
Yes, I would say on balance, that's correct.
Okay. Well, I hope that it bears out that it was good enough for you to come to a comfortable conclusion, because just by my thinking, 50 states, some participating, some not, the number of fake applicants, et cetera, by my view, was a bit small, but hopefully, like you said, it was a big enough effort for you to come to some strong conclusions. I have one last question. Of the fake names, how many of them were more Russian in nature or German in nature or Spanish in nature, or what have you, of the fake names that you put together to try to get through this process?
It's a mix of names. We didn't pick any particular ethnic or other group to create.
So
the identity.
no ethnic group name-wise was over
I don't recall that.
sampled in this? Okay. Well, I'd love to see those names eventually. Thank you very much.
Thank you.
I yield back.
Chair, thanks, gentlemen. Now I recognize the gentleman from Pennsylvania, Dr. Murphy, 5 minutes for questions.
Thank you. And thank you for what you've done here. First, let me ask this, Mr. Bedoyan. When someone is testing out how a system works, do the companies in general run potential names through and see what works? Whatever the company is, whether it's Amazon seeing if someone can order a book, or if it's Walmart testing something, isn't that how generally people do that? They'll put some name in and test it out?
The private sector, from my personal experience, that's an extensive part of what a company does, yes.
And we know that the initial rollouts of the Affordable Care Act, as well as state exchanges, were filled with serious problems. And we had heard previously through many people in our committees who were involved with the state and the federal rollout that they had even consulted with advisors who said there was going to be serious problems with security systems. And I assume under those circumstances, they ran names through and see if information was secure. So I'm assuming this is standard practice. So let me ask a couple of questions here. Ms. Yoakum, in your report, was there, you talked about people who had coverage gaps or they had also some duplication. Do we have any idea what the average or the number is in terms of the number of people who have a coverage gap? Do we have any idea what that number is?
We do not. Yeah.
Okay, so out of the millions of people who are enrolled, we just simply don't know how many may have a plan, they lose it, and they go on to Medicaid, or they're on Medicaid, and so we don't know that. But there's also people who may have duplication, overlap, which costs the taxpayers, costs the government. Do we have a number, idea of how many people that is?
We do not have a national number. We did talk with issuers and also with states who had done some analyses. And right now, those numbers don't appear to be large, but...
When you say don't appear to be large, are we talking thousands, hundreds of thousands, millions?
Like one issuer identified about 18 individuals who were covered in both.
Fair enough.
That's a single issuer in a single state.
So I'm concerned about those from the standpoint of the taxpayers and fraud. I'm also
Right.
concerned about those who lose coverage and don't have health care.
Right.
But we don't know what that number is, though.
We don't have a good number of that, no.
All right. So, but if someone has duplicate coverage, are they counted twice when we're counting how many Americans now have coverage under the Affordable Care Act?
Conceivably, they could be counted twice. It would be, they could be counted under the exchange and then also as a Medicaid enrollee. So I would say yes, that's possible.
So as we're looking at this and we're looking at huge cost overruns, do we have any idea how many people are fraudulently signing up for?
No, we do not.
Mr. McDoyan, can you extrapolate from your data how many people are gaming this?
Absolutely not. As I mentioned earlier, this is not generalizable. It was not designed to extrapolate any rate of fraud.
Because it's just a preliminary study.
And it's preliminary. As I said, we are looking at the entire enrollee database of 2014. If that database proves to be reliable enough for us to conduct analyses, we might have a better idea
And so,
later on.
related to some questions you were answering before, I just want to be sure of this. Is this common practice among other areas of the government to test the system to see if it is vulnerable to fraud?
Well, GAO does that as a matter of course, as part of its broader charge to both.
So is it a generally accepted valuable practice to test to see if fraud?
Control environments, you may be familiar with the Green Book. It's a thick document that lays out the internal controls for the federal government agencies. They're required to follow those, and part of GAO's work, either through audit or
So if you don't do this, how do you figure out if there's fraud in the system? Do you simply ask people if they've defrauded the system, sort of ask a show of hands how many people are gaming the system, how many people are, and which is obviously not going to do anything.
Yeah, you would have to do the work. Asking questions is not sufficient.
So this is the way to do it. And I, as a taxpayer and as a member of Congress protecting the taxpayers, that seems to make sense to me. You have to test the system and find it out. I go back here, when we have had, for example, Secretary Sebelius before us a couple years ago. Remember when the Affordable Care Act first came out, it was supposed to, we talked about 35 or 45 million Americans without any health insurance coverage. And now we're talking about, I hear different estimates, 9, 10, 11 million, whatever it is, people who now have coverage. And so we had asked her, of that, how many were Medicaid eligible for but didn't apply but now have it? How many were not Medicaid eligible for but now have it because the number went up? How many were eligible before for private insurance but chose not to take it? How many did have insurance but their coverage got the pink slip because of new standards for health care, and so now they have to sign up for something new? And how many of these groups were generally folks that did not have insurance before and now could have it? And she said, there's no way of telling. We just wouldn't have those numbers. So I'm puzzled by, because out of this number of 9, 10, 11 million, I still don't know how many people the Affordable Care Act is helping that truly wanted to help. People didn't have coverage and now have coverage. But of that too, what you're telling me is we don't know how many people may be gaming the system. And in some cases, some people could even potentially say, an employer could even say, we don't have coverage here, but here's how to get coverage that nobody has to pay, or here's how you can qualify for Medicaid when you don't really have it. Am I correct that people could potentially do that?
I assume so. If there is intent, they could attempt it.
Okay, and we won't judge their intent, but it seems to me, and I know that there's an old psychological principle that people tend to ascribe motives in others that they live in their own heart. And I mean, I would hope that both sides of the aisle here would try and say, how do we fix this system? How do we deal with the defrauding systems if we don't have that? And so I hope that's a result of this hearing. I yield back, Mr. Chairman.
Chair, thanks, gentlemen.
We need to root it out, but we don't want to use it as a reason to kill the program. We think the program is very important and is working well for the American people. So, Ms. Yoakum, I'd like to ask you a bunch of questions. So I'd like to request you keep your answers short because I have a whole bunch of questions for you.
Do my best.
I want to talk to you about the issues of coverage gaps and duplicate coverage. Can you walk through the reasons why coverage gaps might occur for individuals transitioning between Medicaid and marketplace coverage?
Yeah, it is. Gaps are more likely to occur, somebody going from the marketplace to Medicaid, and it basically is a difference of timing and the dates and when the coverage becomes effective.
Thank you. The Affordable Care Act made a number of changes to streamline eligibility requirements and enrollment processes between Medicaid and marketplace coverage, but still, keep it as brief as you can, your recommendations to CMS to reduce the likelihood of coverage gaps and the impact of such gaps on beneficiaries.
Yeah, our recommendations are really around testing the eligibility processes and identifying if there are common mistakes that keep happening and then providing fixes to those.
And is it the case that CMS has agreed with your recommendations?
They have.
Okay, thank you. I'd like to ask you about the possibility of duplicate coverage through Medicaid and the marketplaces. Why might this occur?
It could occur for their coverage. They have a change in circumstance and they forget to notify the marketplace.
While I understand that there's always room for improvement, CMS has significant safeguards to minimize the impact of duplicate coverage. Is that not correct?
There are safeguards in place. We would suggest that more are needed.
Okay, for instance, APTC that is paid out for enrollees who are terminated for non-payment of premiums or recouped from insurers. Am I right about that?
Yes.
And CMS requires insurers to update their prior month enrollment each month, and recoups APTC provided to for issuers for terminated individuals. Is that not correct?
That is correct.
Okay. Additionally, can you talk about the periodic data matching that CMS has announced to help ensure that consumers enrolled in Medicaid are not also enrolled in a marketplace plan?
Right. They are just beginning to conduct these and are, once again, are sharing, if there are consistent patterns, sharing what needs to be done to fix it.
So CMS conducts periodic and regularly scheduled data matches to identify duplicate coverage and will send notices to individuals with duplicate coverage to immediately end their marketplace coverage if they're...
Yes, our concerns are that they aren't, they haven't yet settled on how periodic to be, and they haven't settled on how extensive those requests are, and we think that's going to be important for them to figure out and apply.
So what I've just said, is that a reasonable approach by the agency?
It is. I think more surety on the periodicity of the reviews would be important.
Okay. It's also the case that some duplicate coverage is allowable. Is that not right?
That is correct. There are scenarios where it is allowed under the statute.
For instance, when a case is transferred to the Medicaid agency for a decision on eligibility, the individual doesn't have to end his or her subsidized coverage in a QHP until the month after he or she is determined eligible. Is that
Right.
correct?
And that's where these checks come in. That's why those checks are important, because it can be cut off earlier and not extended, the duplicate coverage.
Thank you. Would you agree that the best practice at that point is for the marketplace to end eligibility for APTC once an individual has been determined eligible for Medicaid, as some states do?
Yes, in general, and CMS has said that they are working on a way to make that happen more automatically. Right now, it's not automatic.
So CMS is definitely considering that, am I
They
right?
are considering that.
Right, right. Well, thank you very much, Mr. Chairman. I yield back balance of my time.
Chair, thanks, gentlemen. That concludes the questions of the members present. As usual, we may have follow-up questions. Members who are unable to attend may provide us with questions in writing. We'll submit those to you. We ask that you please respond promptly if we do. And I remind members that they have 10 business days to submit questions for the record. They should submit their questions by the close of business on Friday, November 12th. Thank you for your testimony. Thank you for your work on behalf of the taxpayers. Thank you for your efforts to provide integrity to our programs, to make sure that those who are eligible to receive assistance receive that assistance. And very good hearing, very important hearing. And without objection, the subcommittee is adjourned.